It's always a pleasure to be back in Warsaw, where you named your airport after my most favorite piano player. Yeah? Yes, my mother made me play piano since I'm 6, but I'm not here to talk about my strict Korean mother or nor my tearful piano lessons. I'm here to talk about digital health. So just to give you a background about my background, I'm a partner in a venture capital fund. We invest 500K till 5 million euros only in digital health. And we've started, I think, around 2 years ago, and we have seen 1,600 digital health startups so far. We made 5 investments. And what we can provide besides a capital investment is the access to 400,000 general practitioners, hospitals, and pharmaceutical chains. Yeah. So I'm here to talk to you about digital health and why digital health is so, let's say, in every word's mouth. You hear that besides fintech, that digital health is now coming, and even Eric Schmidt said healthcare is the new plastic. And to give you an understanding why this is such a big topic now, I have to go back to the medieval ages. So back then, doctors, they were like gods. Because they had all the knowledge, and normal people, like this poor guy, he's drinking urine. He didn't really know, or the patients didn't really know about what they should do or what the medical knowledge was. So, I mean, like who was not studying business here? See, and these are the smart guys. Yeah? Due to my limited skill, I had to study business. And in business, we come up with all these weird words like asymmetric information. And this is something that happens when people, like doctors, they have in the medieval ages, they have all the medical knowledge, and the consumer doesn't. Yeah? So it's basically like, I sell you a used car, and you as a buyer, you don't know what the price is. So it's basically the same thing. So what they did in the medieval ages, when you were sick, they strapped chickens onto your body. Yeah, so you had to walk around with a chicken until you died, or the chicken died, and it was like horrible. Yeah? But the patients did that because they trusted the doctor. But something's changed. And this is now the access to the internet. Yeah? We have mobile phones. Not like these phones. I mean, I don't know if you had that in Poland, but this was Nokia 5110. I got pretty excited when I was in high school. This was the phone that I used all the time. Yeah? Playing Snake, I sucked at it, but I did. Like, it was one of the few games that you could play. But today, we have access we have small mini computers, like these ones. And they can basically process all the data, all the medicinal data, and also we can have access to the knowledge that is stored in the internet, because the medicinal knowledge is not stored anymore in libraries or books. It's stored in the internet. I don't know if you know this guy. He's called ePatient Dave, and he was diagnosed with kidney cancer in 2007. And this diagnosis, it looked pretty grim, because like the average life expectancy for this type of cancer was 24 weeks. So he was like, oh damn, what can I do? So the doctor said, hey, go sign up to this cancer patient online community, and he did. So he went to that forum, and he looked up. He talked with a lot of other patients who had the similar diseases, and then there were some people who said like, Dave, please try these 4 doctors, because they prescribe a serum that might help. And by the way, here is a number. So he did, and I met this person 2 years ago in Stockholm, and he's well alive. Isn't that amazing? I mean, like I'm thinking about it, like what this platform, if you are a CEO of a digital health platform, what kind of impact you can have on humanity. And basically, like telling you about why digital health is now so, why digital health becomes so more important now is because the knowledge is shifting more to the patient. And this tool here, this cell phone, is like a patient enlightenment tool. Now, speaking of medieval ages again. And this is the definition, how we understand, like in our venture capital fund, how we understand digital health. And I'm standing here in front of you to say that the timing is right now to start your digital health company, because it's the most meaningful and greatest opportunity in your lifetime. So having seen 1,600 digital health startups, we looked at all these companies and we tried to categorize them. So we basically came up with 6 categories here. And I'm going to tell you a little bit more about, I'm going to dive into these categories a little bit to tell you what is going on. I have a friend, he is also Polish, and he works for Ventures. So the first thing that he said when we met actually, he said like, oh yeah, you're a Korean, you must be a very hard worker. I'm like, oh, why does he say that? No, I mean, and he said, Polish people and Korean people are the most hardworking people in the world. I said, oh, that's very interesting. So since I'm here, like this is my 3rd time in Warsaw, and I'm very astonished about the economic development so far. I'm very excited about the stock exchange here in Warsaw. And that's why it's so shocking that 6 times of the GDP of Poland is used annually for healthcare in the US. That's $3.1 trillion. Think of that. You have to. Could you close the door, please? Thank you. You have to work 6 times what you do annually to spend what the US is spending on healthcare annually. And what if I tell you that 60% of these $3.1 trillion US dollars is preventable? Due to, to prevent it, you can do exercise, eat healthier, and not smoking. Who's smoking here, by the way? Look at these guys. So when we talk about 60% of 3.1 million, you see the mass is 1.86 trillion. And what you can do with that, I just wanted to give you an idea. I mean, you can pay the debt back 9 times of the Polish government. Then you can buy tons of White Houses. 5,800, I think. And you could put around 12K people onto the moon. This is just a comparison how much money we could actually save. And when we talk about prevention, I mean, prevention is becoming, let me tell you, how do we understand health? In Germany, we understand health let's say, like a car. When your car is broken, you take it to the repair shop, right? Same thing with your health. If you're sick, you go to the doctor and basically say to the doctor, go fix me. But the thing is that when you are already at the doctor's place, then you're already costing the healthcare system. And when we look at, for instance, who is working in IT and has to sit a lot? Yeah. Do you have already back problems or not? And Tim Cook says it's a new cancer. 1.2 million working days are lost because of the back pain. And there are already startups working on it. For instance, this company, they're working on your posture. So every time when you're not sitting straight, it vibrates. Or there are other companies, also I think from Israel, you have to put it on your back and always vibrates when you are slouching. So this is basically helping you to keep a right posture and preventing you to get actually into a state where you have really bad back pain. What else do we have? I mean, when we think about this, that diseases like back pain or burnout, for instance, cost the German economy 225 billion euros annually. Because loss of productivity, I mean, you probably know what burnout is since you're hardworking, right? And the thing is like, when I had a really rough year last year, and I asked my friends like, what can I do? Like, I am so stressed out, and they're like, do yoga. Yoga seems to be the answer for everything. I have knee pain, go do yoga. Everything. So what we see so far is that meditation apps and mindfulness apps are picking up some traction. We believe that it's because, like in the 1980s, it was about your body, it was about your like fitness, physical fitness. And then like in the 2000 area, 2010, it was more about like mental stability, mental fitness. And now I think in the future, it will be more about spiritual like and mindfulness. It will go into this area. It's because the church, I think not in Poland, but in the other Western countries, the church is pulling out of our lives, our normal lives, and they leave a spiritual gap. And somehow yoga and all the mindfulness apps or mindfulness is like getting into this place. And this is like a pretty, I thought it was very interesting that people are practicing yoga together in a church. Diagnosis. So what if I tell you again, could we close the door, please? Is that possible? Like somebody? Yeah, wonderful. So what if I tell you again that 85% of all back surgeries are not necessary? That means that the doctor is actually like, saying, oh, you need surgery, but it's not right. Yeah, so the diagnosis is wrong. So the thing is, like, I think in the future, computers like IBM Watson are going to help the doctor to make better decisions for the patient. They're not going to replace the doctors, yeah, but they are going to help to make better decisions. But it goes further. I think in the future we will have technologies that actually can tell you by your voice what kind of disease you might have or you're going to have. And this is pretty scary. But I know startups that are already working towards that direction. So for instance, we invested in a company here in Krakow. It was called Harimata. And what they do actually, it sounds really cute. Like, so they have this little game where children are playing this game, and at the end, it will give the parents a first diagnosis if they have autism or not. Yeah, that's because a lot of other children who had autism played that game, and they can filter out a pattern, and they compare it with the behavior, the game behavior of that child. So they can say like, okay, 80%, 90% chance that your child has autism. And this is this is very cute, but think of it. When you abstract this technology, not only for autism, but also for any other disease that is related to motoric skills. And then not only like children, maybe for adults. So this technology, and we had a really weak moment because we usually invest from 500K to 5 million euros, but this company was so intriguing because it can redesign diagnosis. Another company is they are based in Israel. They can already tell you if you agree, if you don't agree, yeah, if you're happy, if you're sad, if you're aroused. So they can tell already what kind of mood you have. And there is another startup, I think somewhere in the eastern region, they can tell you when you have throat cancer, because what they did, they took a lot of throat cancer patients and they said, talk into this phone or talk into that microphone. And so they filtered out a pattern. So whenever somebody is like, talking into the app knows, okay, this guy has throat cancer or not. About the business model, it's a different thing. I personally would not download an app where you get, which tells you if you have throat cancer or not. But this is a different story. This is where I think diagnosis is heading. Treatment. Who has a friend who has diabetes? Oh yeah, so. And this topic really sucks. I don't know if you talk to them and what they have to do. You have to stick ram a needle into your skin, and you always have to measure your glucose level, and then you have to inject insulin, and it's really bad. And the consequences are, if your glucose level is too low, you will probably faint. And if your glucose level is always high, later on you will lose your fingers or toes. And this is so relevant because diabetes patients cost so much money. Yeah, I mean, $245 billion dollars in the US, which equals to, I think, 245K Ferraris. We have an analyst, he's from Italy, and you can see, like I asked him, like, compare it please, and he's like, oh yeah, here, take Ferrari. So this is basically what he came up with. And that's why it was so like, because this is a holy grail, basically finding something against diabetes where you don't have to ram a needle. And this is what Google is developing right now. Basically a contact lens that actually measures the glucose level from your tears. And this is something really huge, because 21% of the diabetes are non-adherent, and they increase the cost annually by 600 million till 1.2 billion. So what does it mean to be a diabetes patient? You know, I just wanted to tell you that, I mean, you meet once a quarter, you meet the diabetician, and 98 days you are alone on your own, and then you have only 10 minutes a day to talk about your disease. So it's really hard to stay compliant for the diabetes patient. So that's why I think this company that we invested in them like 2 years ago. Around 2 years ago, it's a companion app, basically helping the diabetes patient, to cope with diabetes. And there are a lot of, I mean, this is just an example. There are a lot of other apps out there, but this company actually, they received funding from Roche this year. They jumped on it. It's the first time that a pharmaceutical company actually invested in a digital health startup in Europe. So the thing here is, and that's what I'm going to tell you again, you have so much more impact when you found a digital health startup. I mean, this guy over here, he's not an employer, yeah? And the CEO didn't make his employers to, like, you know, tattoo it. It was just users. They love the product because it has so much impact in their lives. And if you go on iTunes and if you read the reviews, yeah, it's amazing. And it gives you so much more back. And here's something, I mean, when I go to, when we conduct due diligence, I always, my favorite question is always, I go to the developers and ask them, okay, so why are you here? And when the developers are saying like, hey, I have so much more impact, you know, diabetes patients, blah, 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 and then I say like, oh, the CEO can actually communicate his vision really good. And I observed that all these companies where the CEO is communicating the vision very clearly and says like, we have impact, that there is more energy in these startups, and yeah, the willingness to work harder. So when it comes to monitoring, I mean, all your parents, maybe they had like, you know, all these devices which were not connected, but what if I tell you in the future that you might have like a plaster which is like recording all your vital signs, recording your blood sugar level, recording your, I don't know. And today, Fitbit is already, or like these Jawbones, they are the first step towards that. They are already like monitoring your activity and so on. Patient-doctor relationship. When was the last time you were at the doctor? Someone recently at the doctor? Yeah, you? Okay. So how long did it take? 15? 10 minutes. And how long did you have to go to the doctor? How long was away from your doorstep to the doctor? 5 to 10 minutes. No, okay. 5 to 10 minutes. How long was the waiting period? Okay, you are very lucky. You're very lucky, sir, because in the in the UK, you have to wait for an appointment 10 weeks for an NHS doctor, which is like, and then you have to go there, and then you have to wait there again. And I think in the future, and this is coming up, it's all about telemedicine. Yeah. So people actually you don't even need to visit the doctor. You can just like talk to your doctor via iPhone or iPad. And I think I already showed you some devices that makes a physical appearance at the doctor's office unnecessary. And of course, again, there are already like some startups which are doing this. This is also a company that we invested 3.5 million into MeDoc. They are from Finland. We just announced the deal, I think, 1.5 months ago, I think. So just to tell you, like from all these solutions, digital health solutions, this was the one side. But on the other side, I wanted to show you the opportunity that digital health has economically. So. Can we try something out, please? Please, get out your cell phone, please. So please get out your cell phone, okay? And now, hand it over to your neighbor. How does it feel? It feels weird, right? Yeah, it sucks. Okay, you can give it back. I mean, the thing is, like, my point here is that we trust this device, this little device, so much data, our privacy. Yeah, we have Tinder here, we have, I don't know, we store our medical data here, we track our activity, it knows where our location is. So this is something, it becomes more like an extension of our body. And that's why, I mean, here you see the smartphone penetration, and we can track with this cell phone, we can track so many things now. Yeah, not with the Nokia 5110, unfortunately, but like with the iPhone, we can track our sleep, nutrition, activity, and that all relates to the diseases. Secondly, what also like a sign that the market is ready, healthcare is the second most searched topic on Google. I'm not gonna, like, you may ask, like, what is the first topic, but like, I'm not gonna, like, go into that. You might know what it is. It has also something to do with health, but yeah. So the thing is, like, venture capital funding in the US, 6.5 billion euros, sorry, I was talking about euros, I'm really sorry about that. $6.5 billion. I'm not quite sure if we can double this year, but it shows there's a lot of VC funding in the US, and it's swapping over now to Europe. So when we talk also about like savings, cost savings that we can have, I mean, like the digital health solutions in 2013 already could save 77 billion euros. So there's a lot of potential, and I showed you already how the healthcare system is already very, very ineffective or inefficient. I say more inefficient, and that digital health solutions can actually help to evolve the healthcare system. So from 2011 to 2014, there were already like 10 digital health IPOs, and moreover, Fitbit was valued 6.2 billion euros. And I think that's this is the chance to found your digital health startup is practically now. This is a wonderful intersection between making business and also doing something good for the society. And this is, I mean, that's why I'm telling you that it's the greatest and the most meaningful opportunity in our lifetime. Of course, when I tell you, I'm telling you about how great digital health is and what kind of impact you can have, there are also some challenges, of course. Legal and regulatory environments, privacy, data security, but also the EHR systems. EHR systems is the electronic health record. So that when you go to the doctor, he types something in, and you have like an electronic health record. And all these vendors are really, really closed. They don't let anyone in. But when you have a digital health startup, you want to become relevant. How do you become relevant? You become relevant when the doctor is finally using your app. But it's so hard. I mean, like, let's say you are a cool doctor, okay? And I'm the digital health entrepreneur, and I say like, hey, man, I have this really cool app, and please sign up on my platform, and please use it. And you say like, okay, yeah, I will do that. But then the fifth or the seventh entrepreneur joins you, and they're like, hey, please sign up on another platform. You will become overwhelmed as a doctor because you don't like it, and you don't remember the password anymore. So that's why. And we're the only one in the world who have that strategic cooperation with the CompuGroup Medical. They have around 4,000 employees. They are worth, it's a public company, and We have a strategic cooperation, and that's why we have the access to almost every second GP in Europe. And so what we did with mySugr, for instance, we actually we are working on an integration, where there's an API from the app to the doctor's information system. So the doctor has in his environment, he has all the data that the diabetes patient actually created. And this access is really unique for the European ecosystem. And so that's why, to wrap my presentation up, I'm here to tell you that we are happy to continuously support the European digital health ecosystem with our capital, with our access. And we are here to talk to you. If you want to found a company, I brought my associate Finn with me. Talk to us. Maybe you know somebody who requires funding. We are always happy to talk and helping digital health companies to flourish. Thank you very much. Sure.
Any questions from the audience? Yeah. Let me just bring the mic over.
Hello, great presentation. Really
Hi.
appreciate it. I have a question related to medical education. I'm wondering, do you know any case studies about what is working for you to convince physicians to use those technologies in their everyday work? Because I know that, for example, in Poland, they are not the most open-minded people, I think. And I'm wondering what you do to convince them.
What do we do to convince the doctors?
Yes, exactly, yeah.
Well, you have to see that since they all use the same software, and this huge platform of the CompuGroup Medical is updated quarterly, we can just push basically the software update onto their systems. And this is something that has a lot of advantages. And then you have to, of course, at some point you have to talk to the doctors and say that there is an update and you can use that. And you have to inform them, of course. But the first step is already, I think, the most critical part here is actually having being already in the information systems. Unfortunately, I'm not working for the CompuGroup Medical. We are a separate fund, and I didn't work there yet, or I didn't work there, so I cannot give you an elaborate, a satisfying answer, I think. Yep.
I've also enjoyed your presentation. I have a question because I think you've presented the patient part of the this medicine 2.0, but I guess there's the other part with the pharmaceutical industry and hospitals and all the stuff that the patient doesn't see. Can you briefly tell me something whether the pharmaceutical companies or the hospitals are open to, including such solutions?
Sorry, can you rephrase it? I didn't hear that.
I'm interested if pharmaceutical industry or the hospitals or from the governmental side, are they open to new solutions? Because all these projects, they're great, but they're all from the patient point of view.
Yeah, but the thing is the patient is now more empowered. They become more active because they have the same knowledge. And they become a part of the healthcare system. So one of our how do you call that? One of our co-investors, he used to work in a pharmaceutical company, and what he says, he was an executive there, and what he says is the pharmaceutical companies are like the publishers in 2000. They know that their business is going to be somehow digitalized and that the patient has more significance. And now they have to actually understand how the consumer health is working. That's why, for instance, Bayer has an accelerator in Berlin. Because they focus on digital health solutions, because they know that the smartphone actually helps the patient to make more decisions by themselves. And the pharmaceutical companies, they have one big problem. It's patient adherence. So it's about the medicine that you take. Yeah, and then they are always like, oh, they forgot it, they forgot to take the pill, and then they get sick again, and it costs more. So what the pharmaceutical industry is interested is keeping them adherent. And the cell phone is basically like you can put all the alarms in there and actually remind them to take the pills regularly. Mm-hmm. What is the question again? Sorry.
Sorry, there's no question. That's just an open comment. I'm just more interested in the business to business in the healthcare industry, not the B2C.
I mean, like this is also the thing that I think the monetization aspect in digital health companies is always B2B. Yeah, pharmaceutical, like this is something that changed, that pharmaceuticals are now ready to actually pay digital health startups, and this didn't happen like 5 years ago. I think like when we look at digital health startups, when they are consumer facing, it's more because they want to iterate the product. Yeah, when you put the app out there, people are using it, then you know like how to make your product better. But the money, the real money that comes into the digital health startup is usually over the B2B area. Yeah, by selling, for instance, anonymized data to the pharmaceutical companies, or showing that the patient is still engaging, like taking the pill regularly. There is one contract that I know of where a pharmaceutical company pays for every active user some amount of money monthly. So this is like, I mean, we can talk about this later in a more depth level, but yeah, according to other questions.
Okay, got time. We've got a gentleman here, and then there was one guy at the back, right, I saw? Yeah, okay, one sec. Yeah, you're next and last.
Hi, hello, my name is Jakub. Thank you for your presentation. For last 2 years, I was managing, I was CIO of the biggest Polish private hospital network, 10 hospitals, 16 outpatient clinics. And I was forced to cope with two biggest challenges: people, means doctors, and regulatory. And my question is, can you compare Polish market, Polish environment to German one in terms of those two, in my opinion, biggest obstacles in development of those
I think
new technologies?
to be quite frank, I think I cannot really like the question was like, what is the difference between the Polish and the German market when it comes to hospitals and to patients? Or
the question is, do you recognize position of the doctors in terms of deciding of do we want to introduce new technology or not for patient in Poland and in Germany? Because my understanding is that the regulatory issues and law and obviously doctors are the two biggest challenges for us technology people who want to make patient life easier, right?
we haven't looked into the Polish market when it comes to doctors, because the CompuGroup Medical is not as dominant in Poland. So where we focus more on Germany, France, Spain, Italy.
CompuGroup actually is very present here. They have like 20 hospitals or 40 hospitals.
They have what?
CompuGroup has already, I think, 40 hospitals here in Poland. So they are.
Yeah, but they're not market leader.
No,
to my knowledge,
not.
yeah.
We don't have a market leader
usually,
right now.
yeah, usually like in these, like in Germany, France, they are market leader, and we focus more on these: Germany, France, Spain, Italy, Scandinavia. They are market leaders there.
So maybe I will simplify my question. Do you think that what are the biggest issues for startup companies in Germany?
I think it's about regulation and privacy. It's about privacy data. I think that people are not yet there to share their health data with insurance companies, for instance. Insurance companies are very slow with adopting digital health solutions. And of course, like, you know, but I think all these things will change over time, because with Facebook, it was the same thing. Like I use or we use Facebook differently than than, for instance, younger people or our children. Yeah? They will find out that it's more convenient, and then they will share data. The same thing is like with these diabetes patients. Yeah? When they see that this is actually helping them and this digital health solution is providing convenience and value, then they are more willing to share data. And I think this will change over time. To talk about like regulations, I think what we already have, like the technology is there to have an electronic patient file, but still you're looking at the time. Okay, then let's talk later about this. Yeah.
Okay,
Last
one
question,
quick
sorry.
question from the gentleman at the back, and then we're going to call it a day.
Hi, I just have a question, because data analysis and diagnosis become like the most important things in medicine now. And the problem is that it's still that you have to maximize the usability of some devices to make patients to wear them every day, for example. And I just have a quick question about your fund, about XLHEALTH. Do you guys invest into hardware that maximizes the usability of patients, or you are more into doctor's side?
No, I mean, like we look at hardware stuff, and I think like I mean, that's a good question that we always like talk about in our fund when we look at hardware. We have like a weekly deal flow meeting, and we look at, of course, hardware, digital health startups, and we always wonder. Sometimes I believe it's faster to scale over software. You know, when you have, for instance, with this diabetes app, you have a software that is independent from the hardware, and then you scale it. Yeah, we have like 2 or 3 million users, and then you start thinking, okay, let's do a hardware business. For instance, like a blood sugar device that you can connect to the cell phone. Yeah? So maybe sometimes we believe like it's better to scale software first and then add on hardware in a later point in time.
Okay, we'll call it a day there. Minson, Sean Kern, thank you very much.
Thank you for having me again. Yeah.
Your questions and answers.